Alexander and all, good morning. Kalimera σας. May I just confirm you're able to see me well and hear me well?
Yes.
That's excellent. So a very warm welcome to this session and good morning also from the European Commission. I am Kyriacos Hatzaras, Program Officer for EU Policies at the eHealth or Digital Health, Wellbeing and Aging Unit in the Directorate General for Communication Networks, Content and Technology, also known as DG Connect of the European Commission. Firstly, I warmly thank the Digital Health Week organizing team for inviting me to address you today, and I'm very thankful for the opportunity to address this forum online amidst the several commitments really at the same time and in the same week. However, I can already sense the motivation and excitement shown around the topics of this week, as I know and have spoken with many of you and many attendees of the Athens Digital Health Week recently. You may have heard, just last week, the Council of the European Union formally accepted the European Health Data Space Regulation. The European Electronic Health Record Exchange format and its specifications are a central component of the EHDS. So, at the start of this year, this community can only celebrate how far it has come. Firstly, also allow me to briefly provide some context on the format's inception and development. So in 2019, the Commission adopted a recommendation on the European Electronic Health Record Exchange format. Since that time, preparatory research and experimentation with the format have been ongoing for some time in Horizon Europe funded and other projects facilitating collaboration across the member states. The start of it all, many in the community will identify as the EPSOS project, some 12 years ago now. And then, since that time and all the way to XE Health, and the work that has taken place within the structures of the eHealth network and My Health at EU, European experts have worked tirelessly on interoperability and cross-border eHealth services for EU citizens. In anticipation of the adoption of the regulation later on this quarter, efforts have been led by the Joint Action, XD-EHR, funded by the EU for Health programme, currently working on the proposals for the technical specifications of the format. So recently, in the last few years, we have thus had a dual process, where first, Horizon Europe funded projects experiment with the exchange of health data, confirming what works, for who, in what circumstances and why, in line with the latest insights from healthcare innovation and new technology adoption research. This input is then channeled through to the joint action that leads the way in formalizing the European Electronic Health Record Exchange format, aggregating and creatively combining the inputs from experimenting projects and all stakeholders. The Commission will then consider these during the preparation of the legally binding implementing acts for the European Health Data Space. With the learning that has been acquired through implementation in My Health at EU, Member State representatives and experts now lead the work and shape the next version of the format for the European Health Data Space. That being said, of course, stakeholder consultation, especially with industry, is an important premise and a key activity. Within the joint action, deliverables focused on the electronic prescriptions and patient summary, new services for EHR systems, there's a certification and labeling framework, and telemedicine under My Health at EU. That is, those deliverables within work packages 5 to 9. These follow a structured approach. Feedback is collected from key relevant stakeholders in different member states through a targeted stakeholder consultation process. Industry organizations representative associations, as well as companies, small and medium-sized enterprises, and others, are the prime participants in this activity, in addition to hospitals, regions, and municipalities. So these consultations include a series of briefing workshops organized by the Joint Action to explain the scope of each deliverable and invite feedback on content and scope. The Commission encourages your active engagement in this activity and emphasizes the importance of your participation to inform and shape the format. Joint Action members will inform you on the most direct channel available to you to contribute your input, have your say, and have your voice heard as a stakeholder. This is an excellent example of a participatory process launched within the EU to shape the next stage of digital health interoperability across our member states. The format will be supported by all electronic health records EHR systems placed on the Union market. It will become a key enabler for the implementation of natural persons' rights to their health data across the EU and facilitate the exchange of health information for patients, practitioners, and healthcare providers. Interoperability specifications are being developed for all 6 priority data categories for primary use, namely patient summaries, e-prescriptions and e-dispensations, lab results and reports, imaging studies and reports, and discharge reports, also for cross-border exchanges through MyHealth@EU. Data sharing is an important element of the EHDS, as it allows the attending health professional to get access to their patient data regardless of where in the EU the patient comes from, be it within the same or a different member state. The format will enable many of these data flows. As such, the format is a key driver of the Digital Decade Policy Programme and the eHealth target of having 100% of EU citizens with access to their electronic health records by the year 2030. Therefore, the format is a key component in driving the EHDS implementation, strengthening uptake of digital health products and services, and shaping the evolution of European digital health. As such, the EU Digital Decade Policy Programme forms an important framework for our work on policy, supporting the digitalization of the European economy and society. We are monitoring targets using an indicator framework that shows already that EHR access by citizens in 2023 was standing at 79%, up by 7 percentage points from the previous year, 2022. So this is a good example of progress with the implementation of the EHDS. We also have great hopes for the international adoption of the format, since we see a lot of global interest in the EHDS regulation. For instance, we were positively surprised to see a proposal to exchange the same priority data categories as those defined for the European health data space through the recently launched Pan-American Highway for Digital Health in the Latin American and Caribbean region. These categories that the colleagues in that other world region have already defined are supported by the format. So we see a lot of potential for collaboration and reuse of the format at the international level, setting a global standard. Today's event, as part of the Athens Digital Health Week for 2025, is an important occasion. It serves to promote the expansion and furtherance of this ecosystem and the coordinated delivery of the European Electronic Health Record Exchange format. We look forward to a collaborative session allowing industry stakeholders to express their views and help align the EHDS timelines with vendor business planning, roadmaps, and other industry considerations. Joint Action colleagues are attending and following this week's events with the intent to hear, capture, and discuss the views of industry among those of other stakeholders. This is so that we collectively move forward in a concerted manner, aligned and in full cognizance of all views and positions expressed towards the implementation of the format and the European Health Data Space Regulation. The fast approaching stakeholder consultations, as mentioned, will be truly instrumental for this. In conclusion, and on our part, congratulations are due for all of you here at this event, those online and those who actively participate in European health data space related projects and working groups, for your efforts and strong enthusiasm and commitment to advance digital health in Europe. We look at all the ongoing work with a lot of optimism and encourage you all to intensify discussions among stakeholders and consolidate the format specifications. Thank you. Alexander, back to you.